Hi guys, welcome back to my channel. I hope you all are doing well. It's a new day and I'm back again with another video. If you're new here, do consider subscribing so you can join your family. Okay, as of now, I think you guys already know that I am a medical student and I trained in China, and I recently came back to Ghana to do my clinical rotations, which is a requirement by most schools in China when you are transitioning from your 5th year to your 6th year. So, I moved to Ghana to actually do my rotations, but you can choose to stay in China or you can go to any country of your choice. So as of now, I'm done with my clinical rotations. I am almost done with medical school. We just have like a few official procedures to go through, and I would say it's done and done. So now that I'm done with my clinical rotations, I just wanted to give you guys a bit of insight on the whole thing. So I'm going to be doing this 2-part series where I'm just going to be talking about things that I think you need for your clinical rotations in Ghana, and basically what you need to know if you plan on doing your clinical rotations in Ghana. So yeah, this is part 1 of the 2-part series, and if you're interested, stay tuned. So this actually covers everybody. It doesn't matter if you trained in China or not. So far as you didn't train in Ghana and you intend on doing your clinical rotations in Ghana, whether as an intern or maybe someone who is post-medical school and you just want to do your clinical rotations and probably are preparing for an exam, so far as you are coming from outside Ghana, this applies to you. So these are things that you need to know. Okay, so yeah, in today's video I'm actually going to be talking about things I think you need for your clinical rotations. These are necessities. These are these are things that I think you would actually need to just help make your journey like smooth. I'm going to talk about your tools, attire, stationery, and some miscellaneous stuff that you would need for your clinical rotations in Ghana. So let's talk about tools. As a doctor, as a medical student, you would need a stethoscope. You don't just need like any stethoscope, you need a good stethoscope, one that can really help to make your work easier when you're examining patients, because you don't want to buy a 10 Ghana cedi stethoscope. Trust me, those things exist. You don't want to buy a 10 Ghana stethoscope and then you would expect to hear like heart sounds or breath sounds correctly. Okay, make sure you invest in a good stethoscope. Even if you have to go the extra mile of watching YouTube videos, watching reviews and all of those things, please do it, because it would help you in the long run. Get a stethoscope that you can use for a very long period of time, one that you can use for your clinical rotations as an intern, or you can even use like when you officially start working as a doctor. So yeah, you need a stethoscope. The next tool is a flashlight or a pen torch. So people might actually kick against this and say it's not necessary, but I think it's necessary because honestly, there are some times that you would have to examine a patient. There are so many orifices on the body that you would end up examining, and you would need like some sort of some source of light. So you need a pen torch, because it's not appropriate pulling out your phone to use the flashlight every single time, because you're going to end up making the patient very uncomfortable. It would just be easier for you to use a pen torch or a flashlight, especially if you are in a place where they don't have those standing lamps that you can use to examine a patient. So I think it's necessary for you to get a pen torch or a flashlight. Alright, let's talk about attire. So when it comes to attire, honestly, it just depends on your personal style. Like, just do you, but make sure that you are dressing to fit your work environment. Okay, you don't want to stand out for the wrong reasons. Make sure whatever it is that you're wearing, you're actually dressing to fit the professional environment that you're in, and also make sure you're very, very comfortable, because trust me, you're going to be doing a lot of walking around, you're going to be doing a lot of standing. Whatever it is that you're wearing, just make sure you can move around freely in it, and you wouldn't have any problems. So make sure that whatever it is that you're wearing according to your style. Just don't stand out for the wrong reasons. I mean, you wouldn't want to wear a pair of ripped jeans to work as a doctor or as an intern. So yeah. The next thing I want to mention are scrubs. So usually when it comes to scrubs, different hospitals have like different policies when it comes to scrubs. I think some hospitals actually designate certain colors for doctors and nurses. Some also designate certain scrub colors for depending on your position. So if you are a consultant, or if you are a specialist, or if you're a medical officer or a house officer, you have like a designated scrub color for your rank or your position. So just make sure that you make that inquiry. If there's none, just go ahead and buy whatever scrub color it is that you want. Just do you. When it comes to scrub, the only thing I would say is to just make sure you are comfortable. I would actually recommend that if you can get your name embroidered on it, it would really help, because sometimes you introduce yourself but then they don't really remember your name. But if they constantly see your name on your scrubs, it will just make it easier for them to recognize you. Yeah. When it comes to scrubs, I would actually say that you can get as many scrubs as you want. For me, I used to wear scrubs just like once a week. That was on duty day and that was it. So one pair of scrubs basically did it for me. But if you are at a hospital where they wear scrubs like regularly, maybe 2 or 3 or 4 times a week, you should get like that number of scrubs so that you don't have to bother yourself with washing your scrubs every single time you go home. The next thing I want to mention is a white coat. You would definitely need a white coat, but I would recommend that you get at least 2, because we actually wore white coats the most. So you can get like at least 2 white coats so that you don't have to wash it every day, just to look your best, because you definitely want to be looking your best. Nobody wants to wear a stinky, stained white coat. So please get at least 2 white coats and that will get you sorted. Alright, the last but not the least when it comes to attire are Crocs. You would need Crocs for when you are going to the theater or when you're on duty, because Crocs are a lot more comfortable. So you should get a pair of Crocs because it's very necessary. You can also wear Crocs like around the hospital because obviously they are comfortable. They are way comfortable than your shoes, and trust me, when you start doing your rotations, you will thank me. Alright, let's move on to stationery. So when it comes to stationery, I would recommend that you obviously get a pocket notebook, because pocket notebooks will really help you to stay on top of the information you're getting from the hospital. So when it comes to ward rounds, all the things you learn from ward rounds, you get to write them down in your pocket notebook. When you have questions during ward rounds and maybe you don't want to ask in the ward, you can write it down so you don't forget, and you can ask the doctors later on. Pocket notebooks also help you to stay on top of your task, especially if you're given like certain tasks that you're supposed to do. You can just write it down and stay organized, and it really helps, and it's very convenient because it fits in your pocket. Alright, so when it comes to like handbooks or some sort of like source of information, I would actually recommend about 3 sources. The first one I'm going to talk about is Oxford Handbook for Clinical Medicine. That book is very good for like quick referencing, if you want to reference like for something. We don't always like have all the information on the ward. Sometimes you would want like a quick refresh of the information you already know. So it's good to have like pockets, resources that you can easily like refer to. The next book I would recommend is the STG, the Standard Treatment Guide for Ghana. So that book is very good for like quickly checking conditions, if you want to check like for signs and symptoms, for drugs and their dosages, or like the whole treatment plan for patients. That book is actually very good, and it's also available in the soft copy, so you can get that book on your phone as well. Last but not the least is TC Anchor. So I want to recommend TC Anchor because usually when you start your clinical rotations, especially if it's like your first time encountering a patient, it can be a bit intimidating because you don't want to go out there and sound stupid. You want all your history taking questions to be on point. So I would recommend TC Anchor because it's a very summarized version for history taking. The whole book is about history taking, and the first part is like just giving you like the general guidelines for like all the questions you will need depending on the area you are taking history for. So that is like very good and very convenient. You can have it on your phone and quickly like check to see make sure you're on track with all the questions that you're asking, so that when you go back to present your case, they wouldn't find questions to ask you. So just make sure that when you are taking your history, you make sure that you use TC Anchor. TC Anchor is very helpful. You can use that to study as well. Alright, so last but not least, these are miscellaneous items. So if you are probably required, or if you choose to do duty that is like 24 hours or 12 hours duty shifts, or if you choose to be on call, as like it's also known, if you would definitely need a toiletry bag. So the reason why I say this is because you don't want to come out from the hospital looking very crusty in the morning, looking like you haven't slept for like 12 hours or you haven't slept for 24 hours. It's obvious that you came to work, but then you don't want to go out looking like that. So a toiletry bag is very helpful. You can keep toothpaste, a toothbrush, a face like towel. You can also keep like some perfume and lotion in it, just to like sort of refreshen yourself, so that when you're ready to go home, you don't look ratchet. Okay, yeah. I would also recommend that you have hand sanitizer and hand cream on you at all times if you can have these two with you at all times, because you're going to be washing your hands like 1,000,001 times when you're on the ward, and you wouldn't always get the chance to go back to your bag or go back to where you keep your bag. So it's best if you have hand cream on you, so you can keep your hands moisturized, so you don't have ashy looking fingers. Because trust me, every single time you touch something, you would want to wash your hands. Every single time you touch a patient, you want to wash your hands. Every single time you set up a tray to work, you would want to wash your hands. So I would recommend that you have hand cream with you. Someone like me, I really like pay attention to those things. I don't want to be walking around with my hands looking ashy. So if you're like me, definitely carry hand cream. The reason why you need a hand sanitizer is because you wouldn't always have a sink available to wash your hands. So it's better to just have a hand sanitizer to reduce the amount of germs you spread around, because you're going to be touching a lot of things and you don't want to touch like your personal items and carry those germs back home. So just make sure that you have like a hand sanitizer on you, so you can disinfect your hands whenever it is that you need to. Alright guys, that is it for today's video. I really hope this video was useful to you, and all the best in your clinical rotations. Make sure you stay strong, because sometimes it can be very overwhelming and very stressful. Just make sure you stay strong and you take care of yourself in the process. Don't forget to like, comment and subscribe, and I'll see you guys in my next video. Stay blessed as always.